Thank you for joining us today. At Hope Bridge, we believe that open conversations can create understanding, reduce stigma, and inspire positive change. We invite you to listen with an open mind, reflect on the insights shared, and be a part of building a more compassionate community.
Good evening to all of you. On behalf of Hope Bridge, it gives me immense pleasure to welcome you all to this special episode on the occasion of National Counselling Psychology Day. Today's theme is Beyond Therapy, the role of a counseling psychologist. And to help us explore this important topic, we are truly honored to have with us Dr. Maxim Pereira. Dr. Pereira is an associate professor in the Department of Psychology at Kristu Jayanti Deemed to be University. With over 17 years of experience in teaching and mentoring postgraduate students, he has shaped young minds in areas such as counseling skills, counseling theories, techniques, marriage and family counseling, and individual and group supervision. His insights bridge the gap between academic knowledge and real world application, which is exactly what today's conversation is about, going beyond therapy to understand the broader role of a counseling psychologist. Sir, we are grateful for your time and for sharing your wisdom with us today. We look forward to learning from you. I hand over the proceedings to Cheta now.
Thank you so much, Sneha. Welcome, sir. And I am Shucheta Kundu, and with me we have Nafisha Afsana. We'll be the co-host for today's session.
Okay.
Sir, so my first question to you would be, in simple terms, what does counseling psychologist do? What is
Right.
the function of a counseling
Yeah.
psychologist?
Counseling psychologists, first of all, uh, listen to people. Before listening, they attend to them. Attending means being available to them. When clients come to meet them, they greet them, they smile at them, they show them a seat, build rapport with them, and show willingness to listen. And first of all, they listen, of course, using various counseling skills and try to understand clients, what exactly clients' problems are, difficulties are, concerns are, and then along with the client, they try to find any solutions that clients want. Yeah.
Thank you so
Thank
much, sir. It was really insightful about what attending is about. Sir, my next question to you is will be about many people are seeking psychologists, but they don't know that what is counseling psychologist and what does a therapist does. So, what is counseling psychologist differ from this general therapy?
Right. So when we say general, see the word counseling and therapy and psychotherapy are used interchangeably by many people. But in the literature, there is a difference between therapist or psychotherapist and counseling psychologist or counselor. Sometimes even therapist, counselor, and psychotherapist are used interchangeably too. But I think I can talk about today counselor or counseling psychologist and psychotherapist or a clinical psychologist. Right? The basic qualification, academic qualification of a counseling psychologist or a counselor is at least postgraduate diploma in counseling psychology or masters in counseling psychology. But I know that even those who have other qualifications like psychology, just psychology or clinical psychology, also practice counseling. Whereas psychotherapists or therapists are basically clinical psychologists who have studied MPhil, that is practitioner MPhil, from institutes like NIMANS and other such institutes, who have done supervised MPhil training after their masters in psychology or any branch of psychology, right? So they would have the psychotherapists basically work with clinical population, people who have serious mental health problems like clinically diagnosed depression, anxiety, schizophrenia, and such mental health problems. Whereas counselors or counseling psychologists, having had basic uh, master's training in counseling generally uh, meet clients who have day-to-day concerns, problems, like simple levels of stress, sadness, or depression, mild anxiety, or concerns like adjustment issues, homesickness, or ordinary levels of problems people face because of their developmental stages. But there is no strict boundary. Even the whole point is uh, mental health treatment is a team approach. A person who has severe mental illness may need a clinical psychologist or counselor or psychiatric social worker and a psychiatrist. So, though there are boundaries, boundaries are sometimes permeable. Clinical psychologists, along with doing personality change work, because of they also do assessments and diagnosis. So, this is the distinction I can say. Difference between counseling psychologist and a psychotherapist is actually a clinical psychologist.
Thank you so much, sir. So, my next question to you would be, what are some common myths that we get to hear about counseling, and when should someone consider talking to a counselor?
Right. So one of the most common myth is that a person who has a concern and has to go to a counselor often thinks that counseling is being mentally or psychiatrically ill. So the fact is that all people need counseling. Like just like all people need exercise for their body, all people need to have some lifestyle management like diet, good sleep, rest, time management, and just like a physical health checkup annually, they need a mental health checkup. So anyone who has not been able to manage their concerns, the difficulties, they should go to a counselor. But most often people take, I think, months and years to realize that they need counseling. I've just met a client, yeah, day before yesterday, who told me that he has been having certain problem for last 4 years, and it has aggravated since last 1 year. Then I told him, why did you not seek help? Now he has thought, after 4 years, after reaching a very higher level of his problem, that he should see a counselor. I think just like we seek doctor's help when we get cold, when we get cough, when we get fever, we should most people should be seeking mental health help to begin with, at least a counselor's help. So the idea that I can handle problem myself, or it is a simple thing, it will go away, I can handle, I can manage, that does not help. The whole stigma about it, people are not yet aware that mental health is a need, is a necessity, is a must, even if you are not psychiatrically ill. Yeah.
Thank you so much, sir. Sir, for the next question, we would like to know what is the most important message you want to leave regarding counseling and what positive change do you hope to see in the next few years?
Right. So I think my message about counseling is that counseling is simple, at the same time it is complex. That counseling is, as I said in the beginning, it's about listening. Listening requires attending. Attending is in simple terms, is a soft skill, but it's a hard, complex skill. Attending is not that easy. Attending means you have to slow down your mental process of judging people, having assumptions. Just be open to, be available to people who come in distress, come in difficulty, and not having preconceived ideas about people. When I say people, about clients, when they come in for counseling, we should be making them comfortable by attending, so they will share their concern. So I think counselors at least I would say beginning counselors must train themselves to be good attentives, good listeners. They must practice attending skills, practice listening skills. Most often people don't know what is listening skill. They say, counseling skills, and they say, what counseling skill do you know? Listening skill. But how do you listen? They have no answer for that. According to Ivy and Zalaket in his book in their book Intentional Interviewing in Counseling, they talk about encouraging, paraphrasing, summarizing as skills of active listening, right? We also know from other sources what active listening means, that we pay attention, being present, and making sense of what others tell us, and then communicate to them through paraphrases, restatements, keyword encourages, other forms, even through empathy, that we are listening. And I think this can be practiced even by all people, even if someone has not had formal training in counseling. It's a basic human skill, I would say, but it requires training if you're really doing counseling. And I see that in the coming days, counseling will become more and more popular.
Hmm.
More people will know what counseling is, why counseling is, and seek help, and not to wait until a later stage where their concerns will become unmanageable. And earlier we seek help, the better it is for people who have these problems. So I'm hoping to see that counseling will be available to most people, it will be accessible to most people, it will be
Hmm.
affordable. Unfortunately, counseling and mental health services are urban centric. They're generally meant for elite and rich. So I am hoping to see a world where it will be available for every person. Like you need not be a rich person to seek medical help for fever, cold, and cough.
Hmm.
But unfortunately, in the mental health sphere, especially the counseling sphere, is not like that. I would want to see that more and more people, even illiterate people, semi-literate people, ordinary people, will understand what counseling is, seek help in counseling, and more people will offer, especially counselors offer counseling not only in English, but in almost all regional languages. That's how I want to, that's how I visualize the future of counseling.
Thank you so much, sir. So, my next question and the final question to you would be: how does counseling help people cope with life transitions like career change or loss of a loved one?
Well, as I said earlier, counseling is about attending and listening by another person, that is counselor, right? When a person attends to a client who is have had a stressful background, that is, loss or a transition in life, they feel very helpless, and they feel it difficult to handle their situation. But if someone just listens, empathically expresses sympathy, they feel heard, they feel understood, they feel supported, they feel validated, and they feel validated that the experiences are real, their emotions are real, their feelings are real. And someone validating a person like this, like the counselor validating the one who is having this difficulty, feels really good about it. And when one feels good about it, then their thought process can change, their behavior can change. So that is what the counselors do in the beginning. But in later part, if a person needs really some techniques, some interventions, that counselors can suggest. So most important, I think, communicating, understanding, validating the experience. So that is something important that counselors should do to a person who is having any difficulty, is what I feel.
Thank you so much, sir. On behalf of the entire Hope Bridge team, thank you so much for joining with us for Beyond Therapy in the role of a counseling psychologist. Your insights and 17 plus years of experience brought so much depth to the conversation. We are truly grateful for the time, knowledge, and inspiration you shared with us today. I also thank Sucheta and Nafisa team for coordinating the session with us. We hope to collaborate with you again, sir. Thank you and good
Sure.
evening again.
Thank you. All the best to you. Yes.
Thank
Thank
you.
you so much, sir.
Thank you so much,
All
sir.
right. Bye-bye. I can leave, right?
Yes, sir. Thank you, sir.